Hi, my name is Dr. Adrian Lopresti. I'm a clinical psychologist and researcher in Perth, Western Australia, and I particularly do a lot of research in the area of curcumin for the treatment of depression and other psychiatric disorders. And in this video I just wanted to review some of the potential effects of curcumin for the treatment of depression and review some of the studies that I've conducted, plus many other researchers have conducted investigating the effects of curcumin for depression. Before I do that, I just want to go through some of the symptoms of depression and what basically that entails. So depression is associated with several symptoms. Some of these are emotional-based symptoms. They can include feelings of sadness or low mood, feelings of guilt, irritability and frustration is common in people with depression. There's also a lack of confidence that people often report, and many also suffer from indecisiveness and feelings of disappointment. It is also common for people to feel overwhelmed, or on the other side, many people could talk about feeling of numbness or flat affect. Stress and tension is also common in people with depression. In terms of the behaviours, there's a reduced interest in social activities, there's a reduced engagement in pleasurable activities, and a reduced kind of pleasure derived from engaging in previously pleasurable activities. There's a withdrawal from others, that's common. And many people also talk about increased time to complete tasks because there's often problems around concentration and focus. Procrastination is often a problem, and many people with depression often use drug and alcohol as a coping tool, kind of manage the symptoms of depression, particularly the emotional-based symptoms. Suicidal behaviours can also be a problem, common problem with people with depression. People kind of, because of the constant pain that they experience and lack of motivation and drive, many people may have thoughts of suicide or may actually engage in actions to kind of end their life. And self-harming behaviours, either through cutting or drug use, again, can be an issue for many people with depression. Some of the thoughts that many people have, they certainly have a lot of negative thoughts about themselves, negative thoughts about their future, negative thoughts about the environment is commonplace when people are suffering from depression. There's often negative descriptions about oneself and the general environment, as I've mentioned. Suicidal thoughts and thoughts about death, which are previously talked about. And from a physical health point of view, fatigue and tiredness is common. People talk about feeling run down or unwell. There's also increased incidence of headaches and muscle pain, and digestive problems are a common problem. Many people describe feeling bloating or nausea, or constipation and diarrhea can be a common problem, often because of the comorbid stress that often occurs with people with depression. Sleep problems are also a problem for many people. Sleep can be a problem whereby they don't sleep enough. They suffer from insomnia, or many people with depression can also suffer from hypersomnia, where they require too much sleep. The same thing occurs with appetite. Appetite changes occur, and they can either be an increased or a decreased appetite. Significant weight gain or loss can occur. And finally, there's often a lack of interest in sex or sexual difficulties such as erectile dysfunction can be a problem. So how common is depression? Well, the research kind of indicates in the last 12 months about 6 to 7% of the population will have suffered from depression in the last year. About 10 to 15% of us will suffer from depression sometime in our life. And many people kind of believe that these estimates are actually an underestimate, but it certainly is a common problem. Women in particular are about 70% more likely to suffer from depression than men. And it's not just a problem that occurs in adults, it can also occur in children and adolescents. And it affects about 15 to 20% of youths before adulthood. Depression is such a problem that by 2020, which is only a few years away, it is predicted that it will cause more disability than any other mental or physical disease. A major, major issue. So what causes depression? Well, there's obviously a whole bunch of lifestyle, psychological factors and social factors can impact on depression. But from a physiological standpoint, depression is actually caused by a number of different factors, and I'll just briefly go through these. Neurotransmitter disturbances, which I'll talk about a bit more in detail in a couple of slides. Inflammation is often common in people with depression. Mitochondrial disturbances. Our mitochondria are our energy cells. They kind of produce energy for us, and it seems as though people with depression have problems with their mitochondria, the energy production components of our cells. HPA imbalances. So HPA is our hypothalamus pituitary adrenal gland. I know it sounds like very complicated, but it's basically our stress response. And our brain tells our adrenals to kind of excrete cortisol in response to stress. And it seems as though people with depression either can have a hypersensitive HPA axis where they produce too much cortisol, or they can have a hypoactive where they don't produce enough. So there seems to be a problem from that standpoint. And there's also oxidative and nitrosative stress, which I'll talk about in a couple of slides too. This all then kind of leads to damage to the brain, and over time, depression can certainly lead to deteriorations in parts of the brain associated with mood and memory and cognitive function. So all these kind of work together to trigger a depressive episode. I just want to highlight just a couple of these physiological disturbances because they have a specific relevance to curcumin and its potential impact for depression. Now, neurotransmitters is the most commonly kind of believed reason for depression. Now, neurotransmitters are chemicals that transmit signals across a synapse from one neuron to another neuron. So basically, there's your neuron here, there's your presynaptic neuron. It releases neurotransmitters, which then latches onto receptors on the postsynaptic neuron, and that then is important for transmitting information. Unfortunately, with people with depression, there seems to be neurotransmitter kind of dysfunction and disturbances. And the two neurotransmitters implicated in depression are primarily serotonin and dopamine. And serotonin in particular has received a lot of publicity because a lot of pharmaceutical antidepressants, known as selective serotonin reuptake inhibitors or SSRIs, are designed to increase the availability of serotonin. Dopamine is our feel-good neurotransmitter, and again, that also seems to be a problem in many people with depression. But neurotransmitters are not the only issue. There seems to be other, as I've mentioned earlier, there's a whole bunch of other physiological factors that can impact on depression. And inflammation is one of them. Now, chronic inflammation is an unhealthy inflammatory over-response that can linger for months to years, whereas acute inflammation is beneficial. It's actually positive. We actually need inflammation to help us kind of deal with injury and infections. The problem is that for many people with depression, they suffer from chronic inflammation, and this can damage many organs, including the brain, and that's why potentially it can have a negative impact on depression. So if we think about inflammation, when we're inflamed, usually it's triggered by a sickness, an illness. And for many people, there's what we call kind of the sickness behaviour. And this is characterised by lethargy, depressed mood, anxiety and irritability is common when we're sick, malice, a loss of appetite, sleepiness, and there's often a reduction in grooming, and concentration problems that are common during inflammation. Now, the issue then becomes, is this person sick or depressed? As stated earlier, many people with depression suffer from inflammation. And it's that chronic inflammation that might be impacting on their mood. And as a result, that's led to researchers to look at the potential for anti-inflammatory treatments as antidepressants. So the research has indicated that in terms of people with depression, many, on the whole, they have high levels of inflammatory proteins in their blood. Many studies have actually shown that if you induce inflammation in somebody, it increases the risk of depression. For example, many cancer-based treatments actually are designed to target the cancer cells, but also increase inflammation. And if you're treated with these medications, your risk of depression is greater than 50%. The problem with inflammation is that it actually decreases success of traditional treatments for depression. So your psychological and your pharmaceutical therapies don't work as well. Your cognitive behavior therapy, for example, there's several studies that show that people with high inflammation actually don't do well from cognitive behavior therapy. What seems to happen is that if you successfully treat depression, it reduces inflammation. So the key here is, if inflammation is an issue, then how do we reduce inflammation and potentially improve mood? Some research has actually shown that pharmaceutical antidepressants have anti-inflammatory effects, and many anti-inflammatory drugs, whether they be natural pharmaceuticals, can lead to improvements in mood. And that's really what made me become interested in curcumin, because of its potential anti-inflammatory effects and its potent anti-inflammatory effects from a natural perspective. Curcumin is also a great antioxidant, and this is an oxidative and nitrosative stress is a major issue in people with depression. So just to give you a bit of background of what that is, we all have free radicals. These are unstable molecules with an unpaired electron, and there's an image of a free radical. Now, the causes of free radicals are, part of it is actually a normal part of our metabolism. It actually occurs, and it's a necessary component of living. But unfortunately, lifestyle factors and environmental factors such as fried foods, alcohol, tobacco smoke, pesticides, pollution, medications, the list goes on, can create too many free radicals. Stress, whether it be mental or physical, can also increase free radical production, and so can inflammation. So to protect us from these free radicals, we actually need antioxidants. And these antioxidants can be produced endogenously within our body or exogenously. So we actually produce it, we consume it through food. So vitamins such as vitamin C and E, some minerals such as selenium and zinc, and many flavonoids found in plants are great antioxidants. Turmeric is also one of those that is a potent antioxidant. We also have several antioxidant enzymes that help us to combat the damage of free radicals. So an antioxidant basically gives away one of its electrons to stabilize the free radical. So when there's an excess production of free radical damage called oxidative stress, this then causes damage to cells, and all tissues are susceptible to oxidative and nitrosative stress. The brain is particularly vulnerable to free radical damage due to its high oxygen demand. So here, free radical accumulation, if it's greater than the antioxidant defenses, that equals oxidative nitrosative stress. And the oxidization of an apple is an example of oxidative stress. Imagine that's happening to our brain. So just kind of recapping on the physiological factors associated with depression, that we've got neurotransmitter disturbances, inflammation, mitochondrial disturbances, HPA imbalances, oxidative and nitrosative stress, and neuroprogression. What influences all of these? Well, curcumin does. Curcumin has an impact on neurotransmitters. It increases levels of serotonin and dopamine. It also makes the cells more sensitive to neurotransmitters. It's an anti-inflammatory. It seems to have a positive effect on mitochondria through its anti-inflammatory and antioxidant effects. It seems to regulate the stress response, the HPA balance. And it also is potent, seems to be quite protective for the brain, and that's what's led to several studies, several researchers now investigating the effects of curcumin for the treatment of Alzheimer's disease and other neurological conditions. So let's just go through some of the research on curcumin for the treatment of depression. And there's a few now that's actually been published. So the first study was a 5-week study with about 40 people. This was a randomised double-blind study, which is basically the gold standard study for a study design. Group 1 had an antidepressant and a placebo, and Group 2 had an antidepressant and 500 milligrams of standard curcumin plus 50 milligrams of piperine to help the absorbability of the curcumin. Unfortunately, what they found, that was no difference between the two groups. So adding the curcumin to the antidepressants didn't actually help people feel better. There's a few flaws of the study. One was that it was too low a dose. 500 milligrams is maybe not effective enough for the treatment of people with depression. The duration was too short, 5 weeks, meaning that maybe it needed to occur over a longer period. Maybe the anti-inflammatory effects of curcumin needed to occur over a longer period. And maybe the form of curcumin was inappropriate. Maybe they needed to use a more bioavailable form of curcumin. So study 2 was a 6-week study with 40 people. Group 1 received antidepressants only. Group 2 received antidepressants and 1,000 milligrams of curcumin extract. BCM 95 is the extract that they actually use, which is a highly bioavailable form of curcumin. And Group 3 received BCM only, 1,000 milligrams a day. What did they find? Well, they found there was no difference between the three groups. So basically, the curcumin was as effective as the antidepressants, which is great news. Many people are interested in a natural form of antidepressants because of the potential side effects associated with the pharmaceutical forms. So this is a really positive study. There was a non-significant trend whereby curcumin and the antidepressant together was more effective than the other groups, but it didn't quite reach significance. Flaws in the study? Well, it wasn't a perfect study. This wasn't a double-blind study, so volunteers knew what they were taking, so they could potentially affect the results. And there was no placebo control. But all in all, positive results. And maybe the duration was too short too. Again, 6 weeks, maybe we needed to go for longer. Study 3, which is a study that I conducted here in Perth, in Western Australia. This was an 8-week study with 56 people. This is a randomised double-blind placebo-controlled study in people with depression. And Group 1 received curcumin as BCM 95. Group 2 received placebo. What did we find? Well, in the first month of treatment, there wasn't any difference between the two groups. Both groups, their symptoms of depression actually improved in the first 4 weeks. However, in the second month of treatment, curcumin group continued to get better, but the placebo stayed same or got worse. Curcumin was actually especially effective for people with atypical depression. And atypical depression is an inflammatory type of depression. Although the word atypical makes it sound like it doesn't occur very often, it's actually the most common type of depression. And it's some of the symptoms are associated with kind of increased need for sleep, lethargy, tiredness. People with atypical depression actually do feel good when positive things happen. And one of the other symptoms is often people with atypical depression actually become quite sensitive to social rejection, social negativity. Study flaws. Well, 70% of the volunteers had recurrent depression. So this was a group of people who had long-standing depression, and the great thing here is that many of them continue to realise benefits from the curcumin. And approximately 35% of people were on antidepressants, although this was a stabilised dose. So that wasn't, the antidepressants couldn't have been the reason for the improvements in the depression symptoms. Study 4, 111 people, big study, 6-week study. Group 1, people with depression were placed on antidepressant only. Group 2, antidepressant plus standard curcumin plus a piperine. What did they find? Greater improvements in the curcumin and antidepressant group, which is great to see. So it seems as though the curcumin actually enhanced the effects of the antidepressants. Flaw of the study: open label designs, meaning the volunteers and researchers knew what they were taking, which can be an issue. Fifth study was a 6-week study with 100 people. It was a double-blind placebo-controlled study, so it was good from that point of view. Group 1 received a placebo only. Group 2 received standard curcumin, and this study was examining the effects of curcumin in people with depression. What did they find? That there were significant reductions in depression compared to the placebo. And the great thing here is actually they measured markers in their blood for markers of inflammation and which is the interleukin-1 beta tumor necrosis factor. They're markers of inflammation. They also measured cortisol, which is our stress hormone, and they also measured something called BDNF, which is a protein in the brain that helps with neurogenesis. And what they found was that curcumin decreased inflammation and cortisol, so our stress response. But on a positive note, it increased levels of brain-derived neurotrophic factor, the BDNF. The study flaws, the statistical analyses were a bit suspect. As a researcher, I'd like to see better analyses of the results. But and it's not clear if it was used as an adjunct, if curcumin was used as an adjunct or a standalone intervention. But overall, great study. Providing further evidence of the benefits of curcumin for depression. Study 6, 4-week study, 100 people, double-blind placebo crossover study, so good from that point of view. Group 1 were received placebo only. Group 2 received standard curcumin plus piperine. Now, this group was, rather than all the other studies I've talked about examine the effects of curcumin in people with depression, this one here was actually obese adults with mild depressive symptoms. So they didn't actually have a formal diagnosis of depression. But they did have high anxiety, but no formal diagnosis of an anxiety disorder. What did they find? No effect on depression, although there was a significant reduction in anxiety. Flaws of the study. It wasn't a clinical population, so these people had mild symptoms of depression, and there was a reduction in depression in both the placebo and the standard curcumin group. But maybe they needed to include a population with more severe depressive symptoms. And probably the main thing here was that 4-week study. In the study that I conducted, after first 4 weeks, there was no difference between the two groups. But it was in the second 4 weeks where things began changing. As a result of this, there was a paper that was published in 2016 recently, where they looked at all the studies. They combined the results of all the studies, all the 6 clinical trials. And meta-analysis is where you combine the results of all the different studies together to help you come up with a more solid conclusion about the efficacy of a product or an ingredient. So basically they collated the data from all the 6 trials and they analysed whether curcumin was effective for the treatment of depression. And what they concluded was that curcumin administration showed a significantly higher reduction in depressive symptoms compared to placebo. So when you analyse the results from all the 6 studies, basically it's looking really positive. The researchers also said that curcumin had the greatest effect when given to middle-aged patients, used for longer duration of administration, so which was demonstrated in my study, that 4 weeks is probably not long enough, maybe needs to occur for a longer period. Given at higher doses seemed to be better. And they actually concluded that the administration of the patented version of curcumin, known as BCM95, tended to have a greater effect on depression compared with conventional curcumin piperine formulas. So this highly bioavailable form of curcumin seemed to have greater antidepressant effects than standard curcumin. So that's something to really consider when looking at choosing a curcumin formula for the treatment of depressive symptoms. And it seems as though BCM95, which is the admittedly is the version that I use in many of my studies, has a most solid research base for its efficacy for as an antidepressant. Now, since this study, I conducted another one, and this was a 12-week study. It wasn't included in that meta-analysis. This was This was the largest study conducted to date, and it was actually conducted over a 12-week period. So it was also the longest study conducted to date. It's a double-blind placebo-controlled study in people with depression. Group 1 received placebo. Group 2 received curcumin, BCM95, 500 milligrams a day. Group 2 received 1,000 milligrams a day of BCM95, and Group 2 and 3. Group 4 received curcumin, BCM95 plus saffron. So I wanted to look at whether adding the saffron would make any difference. And what do we find? Well, we found that compared to the placebo, all the active treatments had significant anti-anxiety and antidepressant effects. And again, the mood lifting effects seem to begin at week 4 again. So what we conclude from this study is that curcumin seems to have this positive anti-anxiety effects. Both studies that I've conducted have confirmed that curcumin has significant anti-anxiety effects in people with depression. And it probably takes about 4 weeks, probably 8 weeks, to start taking effect. So where to from here? Well, more research needs to be conducted. Obviously, the more research, the better to be able to kind of help us identify the effectiveness of curcumin for the treatment of depression. And the question that's really important is, does actually using curcumin in addition to an antidepressant actually increase the effectiveness of the antidepressant? A couple of studies have been positive. One study in particular has been positive, another one wasn't. So we need to really investigate that in future studies. Does curcumin lower the adverse effects associated with medication use? That would be another interesting finding. There are many side effects associated with antidepressants: weight gain, metabolic changes, memory changes, and maybe curcumin can be effective from that point of view. And is curcumin effective for specific symptoms? So, curcumin on its own is effective for specific symptoms associated with depression, such as memory-related problems or sleep. I suppose in addition to this, the other thing that research, the study that I actually conducted, the latest study I conducted, looked at the 2 dosages of BCM95 and determine whether there were differences in the 2 dosages. And basically, what the findings, which were quite positive, were that the lower dose, 500 milligrams twice a day, or once a day, 250 milligrams, twice a day, was just as effective as the higher dose, 500 milligrams twice a day. So it seems as though you can get away with using less rather than more. So more is not necessarily more effective than using a lower dose. And that's great news because it becomes cheaper for people. And also there's less side effects that generally occur in the lower doses of curcumin. Now, curcumin is quite well tolerated, but at high doses it can create some mild gastrointestinal problems, some digestive problems in people. It doesn't occur very often, but it can be an issue for many people. So hopefully with further research and further support through companies that are interested in really providing validated information about their products, we can continue to examine the effectiveness of curcumin for depression and other mental health problems. All right, so thank you very much.